Good evening. Going to go ahead and begin. What we'd like to do is maybe sing a song together. I wonder if Stacy would be willing to play for us. And let me grab a hymnal here.
Dear Father in heaven, as we come together this evening, we do want to praise our Lord and Savior, and how we look forward to the day when we will be able to see Him crowned with those many crowns. And may our hearts be ready to cast our crowns on His feet. Oh Father, we pray that you be here tonight. You have promised us that if we would seek you, while you may be found, that we will find. We come and we seek with all of our hearts. Bless those who are here, those who are coming, and especially along with our dear sister Bonnie, as she's going to be presenting tonight. Speak through her and encourage us. We pray this in Jesus' name. Amen. I want to welcome Bonnie this evening. She's going to be talking to us about healthy choices and combating the common cold and flu. So we want to welcome her, and thank you so much for sharing tonight.
You know, we have such few people here, it's like maybe we want to just squeeze together so it looks like we have a lot more than what we actually do. I know that the common cold is common. People know about the common cold. What I hope to present tonight is a little bit more insight into what I would like for you to think about when you have your next cold. So, as you can see, I have a lot of initials behind my name, and really I have more than this. I've been a wound care nurse in the community for many, many years, and so there's more initials behind, but these are kind of the most important. I've been a nurse practitioner in the community for going on 18 years. So I have a lot of help me with the word. Thank you. I don't need credentials. Experience. Thank you. So I want this to be a little more interactive because it makes me nervous standing here looking at you. So we'll just get going here. So one thing I do like to always talk about is that our bodies are from the Lord. The Lord has made us wonderfully well. And so do you not know that your body is a temple of the Holy Spirit who is in you, whom you have from God? 1 Corinthians 6:19. And millions of Americans battle with the common cold and the flu bug every winter. So how do we get the cold and the flu? And if I took a general census here, you all would be able to tell me exactly how you get a cold and how you get the flu. But I'm going to run through this very quickly for you. The common cold is a virus. I want to know how many of you knew that. Okay, remember that. The flu virus, the cold virus is usually in the upper respiratory. I'm not sure if I can use this very well. Oh, good. This is the upper respiratory. This is where we get our common colds from. The flu virus spreads through the upper and lower respiratory. This is your lower respiratory. Sometimes the flu virus can cause pneumonias. Pneumonias are here in the lower lung bases. And you probably all know that also. So there is no cure for the common cold and flu, but symptoms can be treated. It is the most frequent infectious disease in humans, and average adults contract 2 to 3 colds a year. If you have a really good immune system, you may not get any colds per year. Symptoms of the common cold: runny nose, nasal congestion, watery eyes, sneezing, congestion and cough. May have a sore throat, sometimes muscle aches, fatigue, headache, loss of appetite. You're not going to have all of these. You may have 2 of these. You may have 3 of these. It's just a combination of whatever you picked up from catching the cold. So unlike symptoms of the cold, flu symptoms usually come on suddenly. These symptoms include fever or feeling feverish, chills, along with body aches, fatigue, and weakness. There's a fine line between the flu and the cold. I mean, they have almost all the same symptoms, but the flu, you can tell you are just really sick. You just don't really want to do anything. Whereas the cold, many of you have colds and go ahead and go to work, sneeze and coughing, and you can still be somewhat productive. If you get the flu, you're pretty sick. So complications from colds are relatively minor, but a severe case of flu can lead to life-threatening illnesses such as pneumonia, which we just talked about in that last slide. Symptoms of the cold usually resolve in 7 to 10 days. You all know that? So no matter what we treat them with, the cold is going to resolve itself in 7 to 10 days. So it's nice to have some kind of a treatment, but it's going to go away. Why? Because it's a virus. A virus is short-lived, and it outlives its usefulness, and then it goes away. Symptoms are mostly due to the body's immune response. There's the key. If we stay healthy, if we do sometimes the right things, and we're going to go through some of that later, we don't get too many colds per year. Totally depends on our immune response. Flu is spread when you inhale droplets in the air that contain the flu virus, or the flu virus can get on your skin and can infect you when you touch and rub your eyes, nose, and mouth. Good place to get the flu. Good place to get the colds. So we who are in a community, even here at church, we walk up and down the stairs. We open these hymn books. No, we wouldn't know the last time the hymn books got cleaned or whatever. Somebody may have had a cold the night before, use the hymn book, and we come and we open it up and we may get a cold. Touching things. And then what happens is that we do this, or we'll do this, or we'll do something on our face. Something, and then that gives you that cold. It has to come from somewhere, and it enters our body through these orifices. Despite advances in the prevention and treatment of the CDC estimates that deaths related to the flu range from 3,000 to 49,000 deaths per year. That's pretty significant. And that's one reason why it is recommended by the CDC to obtain the flu vaccine, either by the flu shot or nasal spray flu vaccine. That's what the CDC recommends, just because of all of those deaths. The most common months for the cold and flu season is between October and March. I know that we are going on the end of that time frame, and probably this talk would have had a lot more people here if it was in October, because people are always concerned about the cold and flu and how they can prevent it. But I still think that we still all need to know about it and keep it foremost in our minds when we are in our communal areas. When you're at home and you live among your own bugs. And so we don't get sick too much. But when we come out to church, or you go shopping, or you go to other places where a lot of people have touched things, that's when we get the cold or the flu. So progression of the cold usually begins with fatigue, feeling of being chilled, followed by a couple days of running nose and cough. How many of you can answer to me, you just know, you just picked up something. You go home and you just know. You got something from somewhere. It's just innate. Somehow we just know we're just not right. We are sneezing a little more. We've got this cough. We just don't feel as good as we normally do. There's something going on until we think, okay, we picked up a cold from someone, somewhere. And symptoms may begin within 16 hours of exposure and typically peak 2 to 3 days after onset. Causes of the common cold is the rhinovirus. How many of you knew that? So, the rhinovirus infection proliferates in temperatures between 91 to 95 degrees Fahrenheit. And this is why it occurs primarily in the nose. Our body temperature is 98.6. Give or take a little bit. We can go down to 97. Sometimes we can go down to 96. But in our nose, it's a little bit cooler because we're taking in the airflow of our air around us, and so our nasal area is a little bit less temperature-wise. And so that rhinovirus loves that environment. All that mucus, lots of places to go. The common cause of the flu is the influenza virus. It can either be A or B. The flu attacks the body by spreading through the upper and lower respiratory system. We already briefly talked about that. And we already mentioned this a little bit, is the primary method of prevention is hand washing. Many of you know my husband. He talks to a lot of people here. He does a lot of things around the church, especially on Sabbath. And so he goes home and will not touch anything when he walks in the door until he washes his hands. And he never does this. He never touches his face. He said, I don't know where my hands have been or who I've touched. And I've touched a lot of people. I've shaken a lot of people's hands. And he's up and down the stairs, and he's here, and he's everywhere. So it's always amazing to me that he does that. And he never gets sick. He rarely has a cold. So kudos to him washing his hands. The common cold is the most frequent infection. I think we already covered that. The average adult contracting 2 to 3 colds a year. Treatment. No treatment or herbal remedies have been conclusive. And they are conclusively demonstrate to shorten the duration of the infection. There is really no treatment that's going to shorten your cold. It does, that virus has to live out its life. Sometimes no matter what you do, you can go and get a lot of medications. Do you still feel miserable? Most people do. Do they alleviate some of the symptoms? Sure. They'll take care of some of the things. They might help the runny nose, or they might help the cough. So treatment consists of symptomatic relief. Plenty of rest. Not too many of us do that. Drinking fluids. That'd be great. And gargle with warm salt water. Do those 3 things, you'll get over your cold in 7 to 10 days. You can take a few other things. So I just thought I would just briefly go through a few of these things. Simple analgesics, acetaminophen. I know you all have this in your cabinet at home. And antipyretics or anti-inflammatories, ibuprofen. How many of you have this in your cabinets at home? No ibuprofen? Or there are anti-inflammatories such as Advil, Motrin, or Aleve. They're all in the same class. It's all the same type of medication. Or you use cough medication. The most common is Robitussin, or some form of it, DM, or whatever. And so what's in Robitussin? Exactly what's listed here. Dextromethorphan and guaifenesin. Both of them are just cough suppressants. Sometimes you go and look for some cough medications, it just has guaifenesin. Some have just dextromethorphan. So you just kind of have to look and see which one is the best one for you that will help with your cough. But Robitussin is the most common. I don't know if you can see the top of that, but this just says treatments continued. Decongestants. We feel pretty congested when you have a cold. So one of the biggest things that they always think about decongestants is the Sudafed. Have you all, anybody taken Sudafed? Taken Sudafed. The thing that's in the Sudafed is the pseudoephedrine, and that's in a lot of other meds. Sudafed has kind of been overused. So now you almost have to get a physician's prescription to get Sudafed. Pharmacy has now put this behind the counter. You can hardly get Sudafed over the counter. I've had this for some time, so. But this drug, pseudoephedrine, that's what I want you to think about when you think of Sudafed. That's just the brand name, but the pseudoephedrine, these drugs can increase blood pressure, and you must be careful when using these as a decongestant. Plus, they have many other side effects. Men who have prostate issues have a really hard time going to the bathroom after taking pseudoephedrine. So you have to be very careful about what medications you're taking for decongestant. You know, you don't think anything about it, going out and just all looking. How many of you have gone to Myers and just look at the array of cough and flu medications? It is astounding. Someone is making a ton of money on all of that. So we have lots of nasal sprays. I just listed a few: Dristan, Neosynephrine, Afrin. But I'm always cautious about nasal sprays, because, especially these few, because sometimes you get a rebound effect. If you use a nasal spray too often, you spray it in, and then you got to use it a little bit sooner. You got to spray it in, and then you got to use it a little bit more sooner, and that's that rebound effect. It doesn't last as long as it should. So be careful about getting nasal sprays for colds or flus. One other big drug or class of drugs is the antihistamines. Many times people want to go and get some Benadryl. Good drug. It's a big-time antihistamine, but it's very fatiguing. It will make you go to sleep. So if you want to sleep the day away, use a little Benadryl. If you don't, try the Claritins or the Zyrtex. They have just as much antihistamine in them as the Benadryl. Or chlortrimeton. That's another drug that you could use for an antihistamine. And just as I listed here, antihistamines reduce the effects of the histamines in the body. Histamines can produce symptoms of the sneezing, itching, watery eyes, and runny nose. When you pick up a cold, that rhinovirus, it stimulates those histamines, and that's what gives us this runny nose, watery eyes, and just plain feeling miserable. So you may want an antihistamine to take care of those particular symptoms. Just be careful when you go out and buy the drug or drugs. Also, another really nice thing to use when you have a cold, now this is just a Myers brand, but it's the chest vapor rubs, Vicks Vapor Rub. It provides some relief at nighttime. This just contains camphor, eucalyptus, and menthol. That's all it is. It's not really a big-time drug, and it sure is very relieving. You know, just put it just right here, and it just, you feel better after you breathe it in. That menthol kind of is almost like a vasodilator. It just kind of makes everything open up for you. So some of the names of ingredients you'll find in a lot of medications. I just want to talk a little bit about some of these. This is a complete allergy. You know what's in this? Benadryl. That's all it is. Benadryl. Okay? And this daytime cold flu soft gels. This one's got quite a bit of things in it. I was going to read if I could even see it. It's got, let's see if you can, pseudoephedrine, which we just talked about, which is, it's what? It's for congestion. Yes, pseudoephedrine. Guaifenesin, cough medicine, acetaminophen, and dextromorphin. This particular capsule has all of those that's in it, which really isn't a lot, but remember what I said about this drug, the pseudoephedrine. Look at your package labels. This is not an easy drug to take, and so many of us Americans have high blood pressure. I hate to say that, but we do. And so you have to be careful about what meds you're going to take in. So this one looks like, oh my, this looks really good. It's going to take care of my nasal congestion. It's got a pain reliever. It's got a cough suppressant. That is just what I need. I have all those symptoms. Look and see what's in your medication. Here's another one, Meyer. One thing that you will, well, let me get through this. One thing, this one is a multi-symptom, head congestion. Let's see if you all can pick up some of these names now. Let me see if I can find the ingredients on here. Oh, here they are. Sorry. Acetaminophen, chlorpheniramine. It's like this second one that I'm going to talk about right there. Chlorpheniramine, dextromorphan, it's a cough suppressant, and phenylephrine, which is a nasal congestant. You just kind of have to look and read the labels. See what is in these meds. So one of the other things, like this slide right here is, if I could reproduce, I should have reproduced for you, because this is what I'd like for you to take to the store if you ever want to buy some medication, because you want to look for that phenylephrine. It's a nasal decongestant. You want to look for chlorpheniramine, which is antihistamine, which is not nearly as strong as Benadryl. And then the dextromorphan is just what's in Robitussin. And then the menthol, which is cough suppressants. Halls, menthol, 8 milligrams, Halls. We all suck down on those when we get a cold. I just go out and buy the Myers brand, cheaper. Menthol, 7 milligrams. All it is cough suppressants. That's in there, menthol. Either one, whatever you so choose. But if you can just kind of think about the drugs that you are wanting to have because you have these symptoms. Think about what you're taking in. So, antibiotics. How many of you have ever gone to the doctor and said, I have to have an antibiotic. I can't get over this flu or cold without an antibiotic? No one here? Good for you. Well, thanks for admitting it. A lot of people have. A lot of people go to the doctor all the time and ask for some antibiotics. They have got to get over this cold and flu, like tomorrow. And some antibiotics are prescribed because people expect them. They go there and they do not want to leave that doctor's office without a prescription in the hand. No matter whether the doctor says to them, go and get some Tylenol, go and get some Vicks VapoRub, go and get some Robitussin. You'll feel better. It's a virus. It's going to go away after 7 to 10 days. But we Americans want that antibiotic. Just keep that in mind. So I also want to talk a little bit about the alternative treatments, because there are other things we can do besides all of this meds. These are things that you can use because we want symptom relief. But there are alternative meds, not meds, but alternative treatments. Echinacea. It is widely used to fight infections. May help if taken in the early stages of the cold. Comes in many forms, includes tablets, juice, and tea. It's a great anti-infective. It really kills a lot of infections. Zinc lozenges relies on frequent dosing, must be used short-term, less than 5 days, and studies have shown it to be an unreliable way to reduce cold symptoms. So additional research is needed for that. A few years ago, this came out, and zinc lozenges were the big-time thing that we all went to because we thought that that was the thing to use. And it didn't alter the course of your cold at all. And so zinc lozenges have kind of gone by the wayside now.
I asked my doctor how he keeps from getting cold because he's sick people all day long. And he told me, he said, my secret is echinacea and zinc.
Yep. Yep. And you know what probably the biggest thing is? The echinacea would be my guess, just by hearing about the zinc. And it's just not as effective as they once thought. But you know what? With research, it may come out next year that it's the big guns again. Research goes in circles. Yes. Yes. Yeah, but do you get to it like right away? Yes. If you can get to start using Zicam right away, yes, it can. But that is the issue with using Zicam. And most people, as we talked about a little bit ago, you really become infected, and then you realize that like 16 hours later or so that you really do have a cold. And Zicam needs to be used like right away. So if it works for you, I would say keep using it. It does not work for the general population because it's basically zinc. I think if you would use it with echinacea, I think you'd be really doing well. And then the saline nasal sprays. This does help to reduce nasal congestion, restores moisture to dry nasal passages to lessen the inflammation of the mucous membranes. And as I said, this is saline nasal spray. It's not those other medications that you get rebound. You can use saline nasal sprays much as you want. You can use it all the time. You can put it in as much as you want. It does not hurt anything. As long as you do it the right way. You know, you have to close off one nose and then do like that and then close off the other side and squirt it in. And that's the best way. But saline nasal sprays are very effective. Now, do they really help with your colds and flus? Jury's out. Not sure. Symptomatic relief. Saltwater gargles. Warm salt water helps to reduce swelling and temporarily relieves the sore throat. That helps all the time. A lot of times when patients come to me and I ask them, or tell them to use a warm salt water gargle or Listerine gargles, because Listerine will take care of all of the bacteria in the back of your throat that may have been causing the sore throat or the irritation. Eucalyptus is another alternative treatment, provides temporary relief of the nasal and pulmonary congestion. It comes in cough drops, lozenges, and you can't see the bottom. And it comes in a steam inhalation. So eucalyptus is another nice way of taking care of a cold, and it smells really good. Elderberry provides an improvement in headache, nasal congestion, and cough. Comes in lozenges and is taken 4 times a day, but it must be taken within the first 24 hours of onset of symptoms. It's, again, very time sensitive. So it's very not as effective some of the other kinds of over-the-counter or alternative treatments that you can find. Vitamin C, ideal. Anytime you have a cold, onset of cold, take as much vitamin C as you can. You cannot take too much on a short-term basis, because once you take too much vitamin C, you will urinate it out. Your urine will be rich in vitamin C and turn a really nice-looking yellow. But you can take between 500 to 2,000 milligrams a day, and it really does give you that little bit of boost that you need. Now this one is I found this in my reading, but I really don't know a lot about this rooibos tea. Oh, okay. But it has high level of antioxidants, and it's used for respiratory disorders. So I thought I would include it, but I really don't. You do use it? And what I was reading on it, it's just an antioxidant. You could use it not just for colds or flus, you can just use it to prevent any kind of infections or other things that may touch your body. So I kind of like that, but I just never heard of it. So here are a few more alternative treatments. Sage has an anti-inflammatory property and can be taken as a mouthwash or a gargle. Just mix some sage in some water and gargle. Mix it up. And then, of course, hydrotherapy. This does include hot and cold treatments. And I know that many of you have used some of these, and that's very effective. If you can tolerate the cold, and then real hot, and the real cold, but it's very effective. So, trying to wind down and put all this together, I just want you to be aware that we can follow a healthy lifestyle by one. Can you read that okay? By eating meals rich in highly colored fruits and vegetables. We definitely learned about that last Wednesday night with the Forks Over Knives, how they really promoted the plant foods for our bodies. And then number 2 is manage stress. Oftentimes, if you'll go back and think about when you had a cold, you have had something stressful that's happened just prior to that. Oftentimes, it is let your guard down and then you somehow end up with a cold. Not only just because you pick it up by touching things, but we just live in a stressful world. And we just need to learn to manage it by trying to not be so upset over things, or try to be a little more calmer. Number 3 is regular exercise. I thought this was a really good one. Walk briskly. This increases your neutrophils, which are the natural killer cells in our bodies. And these immune cells stay elevated for 3 hours after a 45-minute walk. That is really amazing. I mean, I know all about the neutrophils, but I didn't realize that they stayed elevated for 3 hours after we kind of do some brisk walking. So that alone will increase your immune, so prevent us from having colds and flus. Of course, adequate sleep, and that's almost a laugh, isn't it, in today's society? Who gets 8 to 10 hours of sleep every night? Not too many people do. Wash hands frequently. Have we said that before? Wash hands, wash hands. After being here, wash your hands. Don't touch your face. Don't touch anything on your face. No, don't do anything around your mouth. And number 6, I thought I would just bring that to your attention, and I know everybody here knows this, but you cover your mouth and nose when coughing and or sneezing, but you cover like this. That got kind of loud, didn't it? Like this. Like this. Please, because I have seen this, even coming to church. People sneeze, and then they touch the handrail. And I think, oh, I'm going to go around this way. Or they touch something, and it's just they're not thinking. And I understand that. But all those droplets are now on their hand, and they're shaking hands, and maybe they don't feel bad, but you just had a stressful day, and you didn't get your exercise that day, and you didn't get adequate sleep, and all of a sudden, whatever was on them is on you, and you just picked up a cold. Or worse yet, if you picked up the flu. So these are some of the things I just want to stress to you as you leave here, and it's basic information that we all know, but we just have to have reminders to always be aware so that we do not have to have the flu or the cold. By being careful and thoughtful, No colds or flus this year. So thank you for being very attentive. And, oh, you have a question?
Just wondering how long a flu or a cold virus is running outside?
Outside? You know, I should have looked that up because I know that they are on certain surfaces for 4 or 6 hours sometimes. So, but I don't know the exact time frame that they, are you talking about like on a hand or on the back of the pew or something? Yeah, they stay there for quite a while. 4 hours. Mm-hmm. It is. Exactly. There's many different kinds of flus. The one that we have been had the flu vaccine for this year is the H1N1, which is the what they call the swine flu. But that's what they're being vaccinated for this year. So almost every year they work up what they feel like is the cause of the flus for this year, and then they work up a vaccine so that people can prevent get it so they don't get the flu, especially in the very young and the older 65. That's when people get really sick with the flu and have comorbid problems like the pneumonia, and they get very sick. Yes?
Do you have any suggestions or precautions for travelers when you're in a closed space like an airplane or a train or a bus?
Yes. Always take those, alcohol cleaning for your hands. Always. So every time you touch something, wherever you are, especially in a train station or in an airplane, airplanes are like the worst because it's such a closed environment and they get that air circulating the same. Somebody spreads or coughs, and they don't do it like this. They just cough out. But if you get the alcohol cleaners, and just make sure you always wash your hands, because you can stop that infection from spreading to you just because it's on the hands, but you just have to wash your hands so often. And just like your doctor doesn't get sick because he takes eucalyptus and zinc, is it echinacea, sorry. I wash my hands all the time. I mean, because how many times have I touched my face tonight? Just, you think of, oh, I got a little itch, I got this. We touch our face a lot. And so it's imperative that we wash our hands a lot. So that would be the best thing that I would suggest to prevent from you having a cold on an airplane. One other thing which I don't think is out of line is if you take a mask. Take a mask with you and put it on when you're on the airplane. It's just protection for you. It doesn't hurt a thing for you to wear one of these paper masks while you're on the airplane. That's a tough place. Yes. Yes. Correct. 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 Well, and bugs don't tend to live on anything stainless steel either. So that has a factor for it. But the woods do harbor the bugs a little longer. And inside here where it's warmer. Yeah, absolutely. They are temperature related. Yes.
Have you read anything about the connection between sugar intake and immune system?
Oh, yeah.
I didn't mention anything about that, but
No. Absolutely. That is a big time issue. That's why I said eat right, because anytime you take in higher doses of sugar, you're going to decrease your immune system. So, and we want those neutrophils to be increased. Yes. Not really. Not that I have been able to find, but I think he's going to talk a little bit about that charcoal. The other thing that I wanted to briefly just say, too, is that, people get stomach flus. And that's a totally different arena. That's more of a gastroenteritis. Charcoal can be used more for that than the actual cold and the flu, because you can take that in and then it kind of settles things down. But it's not really for the regular cold and flu, although he might have more to say on that. Maybe. Any other questions? Thank you.
Thank you, Bonnie, very much. Is that helpful? I want to share a few